Yes, let's have that conversation on addressing doctors' deficit in Medicare in Nigeria. Nigeria, as we speak, is currently battling with acute shortage of manpower in the medical profession, and this is due to mass migration of health professionals to developed climes, especially medical doctors and nurses. Of course, why would anybody want to work in an environment that is not conducive or where what they are giving to the society is not commensurate with their wages? So as we speak presently, according to the statistic before me, we have an average of 4 doctors attending to 10,000 patients, and that for me is very, very draining. So how did we get to this point, and what are those strategic elements that government must put in place to address the deficits of doctors and other medical professionals in the country? We'll be having that conversation with Dr. Benjamin Olowojebutu, first Vice President, Nigeria Medical Association. It's a pleasure to have you.
Good morning, Jibal. How are you today?
I'm very well. Are you?
Very well. How's family?
Okay, very good.
Good
I'm just worried looking at the statistics and the number of, the ratio of doctors to patients in the country. I watched the Honorable Minister of State for Health, Dr. Salako, at a particular summit in the United Kingdom where he was lamenting that what we are facing presently in terms of medical professionals in Nigeria is dangerous, and government is trying to do something urgently to address the situation. Looking at the statistics now, is it strong enough for us to declare an emergency immediately in the medical profession?
Thank you very much. We have said this thing several times in the last few years that the declining rate of doctors in Nigeria and the emigration rate of doctors leaving this country is increasing by the day. So there are things that government are supposed to do.
But you're still here.
Yes, because I'm different. I'm just
You're 1 out of 10?
I'm just like a very patriotic Nigerian. I believe I have a role to fix in Nigeria, so I'm still here. But you know, not everybody has that same energy or that same thought processes. But you must make the environment very conducive for doctors to stay. So, as I said, very correct, 4 to 10,000. Do the maths. It means that they are overworked, they're overstretched, they will fall sick, they will have chronic diseases, they will die, and their families will not enjoy them because they are working their ass out. So for me, it's about what are the pull and push factors. If the remuneration is adequate enough for doctors to stay in this country, they will stay, which means you pay them good salaries, their tax holidays, their tax reliefs, you don't tax all their money. And when you increase the salaries, you don't put a lot of tax to take away the salaries again. And you make them feel very comfortable, very happy in their country. There's security, there's education for their children, there's functional housing for them, there's proper transport system for them. They will stay. It's just easy thing to make them feel very, very comfortable in their own country. But imagine a doctor finished school and is earning a salary that cannot even buy him a proper suit after work. I think it's alarming. So for me, they're trying. We've corrected our salary, the backlog salary for about 14 years. It's just been corrected, and there's a CBA ongoing that will also help us improve the salary. But government must be very, very frontal about it. If we need to call an emergency, we need to call an emergency. Because I hear the Minister of Health say in the budget that last year's budget, you only had 35 million of it. So that means personnel training wasn't there, budget for infrastructure development wasn't there. It means that there has to be something that has to be done. That government understands that it's an emergency. I heard that the budget we are spending this year now is 2025 budget. So we have never started 2026 budget.
6.
You know, an election is coming out. So who now begins to explain to our society, to citizens, that we are using backlog budget for a future activity? How does it work? So obviously it means that we are not serious yet as a country. If you not make healthcare a priority. So, okay, now, doctors die. Who celebrates them? I was telling Minister of State, I said, whenever armed forces die, they have Armed Forces Day remembrance. When the doctors die, nobody remembers them but their family. Why? Are they not as important as the military people?
But okay.
Are you getting my point? So for me, so first things first, that we are losing even younger people wanting to study medicine again because they don't see any future. It looks very bleak. If you go to secondary school now, ask how many students that wants to be doctor. They'll tell you, no, I want to be a big boy. What's a big boy? They'll say it's Davido and Wizkid. Nobody wants to be a doctor because they don't see the light anymore. You know, when we're younger, when you see a doctor with a white coat, with a stethoscope, you want to be like that guy because he's driving. But when I finished back in the days, then all of them got a car, all of them go houses, our teachers. So they look prim and proper. Now, doctors have to enter Danfo, enter Molue to go to work because they can't afford to buy a proper car.
Okay, so how did it get this bad? Was it that we've been very, very careless, or all of a sudden that deficit just crept in over the years?
It's because we don't pay attention to details in this country. We don't. When last did you hear this? When last did you start hearing these statistics? Recently. Before now, did you start hearing? Did you ever talk about it? Because it looked normal to us in Nigeria. Okay, doctors are not available. We'll go to the chemist. We'll go to the Babalago. We'll go to Yalomoe because those ones are readily available. But now that those ones cannot handle our channels again, we're not remember that, even as of now, the doctors are not many. So we didn't look at the statistics. They've said that how do we do it? Let's recruit more doctors, more medical school, have more medical students. So even though people are leaving the country, let's be refilling them. What is the quality of refill? What is the quality of how are you empowering the teachers that are teaching them?
Quality of training.
Are they adequately trained? Are they adequately paid? Because if you're not very happy about what you're doing, you just do it shabbily. So the point for me is that government has not made healthcare a priority in this country. It's all a lot of ulabalu paraphernalia. There are things that you can build structures, but you must build the people that will use the structures. The manpower is very, very key.
Perhaps sorry to butt in here, and I'm wondering. Okay, I do understand that you're a medical doctor, and I also do understand that you carry the burden of championing the cause of those in your profession. However, do you also understand that the economy itself needs attention? So what takes priority? Government saying, look, medical healthcare takes substantial part of our income, or better still, let's make the economy better or we do economic of scale. Well, let's attend to other parts that will make us do you better. Which one comes first?
So for me, it's a deliberate action. Both must come together. Because what increases the GDP of a nation is the workforce of the nation. And if the workforce of the nation is not health conscious or they're not well, there's no GDP increase, there's no productivity. The problem we have now is that we have not managed the economy and accountability enough. The loopholes are still there. People are not checking the loopholes. We're just looking at the economic graphs, and it's fine. But if we are determined as a citizen and says, we want to scale up our economic indices are going bad, you must improve the level of your workforce.
So for an economist, when he talks to you now, you say, look, I do understand that you need better remuneration, you need better environment to work, better retraining facilities to function better. However, everything, no matter the amount we give to you now, if like we have at the moment inflation. Inflation caused the push effect of the Middle East crisis, inflation, because ordinarily we didn't bring that on ourselves. That one just came out of the blue. No matter how much you earn, this inflation that is making you buy fuel at 1,330 or 50 will wipe up that. How about getting the economy better, reduce inflation, get loans at single digits, you can start up your hospital, you can make the economy, even when you, no matter the little you earn, it is better. But doing the two pari passu doesn't work here, because I don't think the government, I'm not speaking for government, but I don't think they have the luxury of doing this for you and making the economy function.
I don't agree with you. I don't agree with you at all. I believe that everybody in the government has specific roles that they're doing. There's a minister of health, there's a minister of budget, there's a minister of budget and planning, and everybody has a specific role in governance of what they need to do. If minister of economy is not doing his work, or he doesn't understand that inflation will come up, obviously, because it's a growing economy, and we're not all focused on elections, we're focused on driving the small funds we have on elections, it doesn't tell us about how serious we are about the economy. Even if there's no fund now, you can see people going for convention here, convention that, convention that, and they're not spending money. They're spending money. So if you see out of those money, I've said it several times, and I've told even billionaires, I've said, if any of them truly loves and are passionate about healthcare in this country, they can call Adopt a Hospital. And I've written a proposal about it several times. I've said, if a big man says, I have gone to abroad to get healthcare, and I've seen how things are done properly, and I love my country, Nigeria, I want to adopt one hospital, and let me make it a model for how things are done properly, so that I can use that same facility as my own facility in my own country. When Senior George Bush died, where did he die? In America. When Billy Carter died, he died where? In America. We must begin to develop a culture of building the reputation of our economy and our healthcare system by those that lead us in this country. One, what does it do? It brings foreign direct investment. And people believe, okay, if this great governor, this great president, this great minister can do procedures in Nigeria, it means there's value in Nigeria, not only by population, because what we have done in this country is that we value growth by population. But you know, in China has even reduced because of population explosion. So we just think that having children is normal. We measure our growth in Nigeria by population, not by GDP, and it's wrong. Because somebody comes and says, okay, if I sell this tomato for 200 million people, I make money. That's not how to measure growth.
Okay, Dr. Olowojebutu, I also want to slightly disagree with Joshua. I know the economy is still struggling.
Yes.
Well, yet you see this
politician
going in convoys, enjoying perks of office, without sacrificing anything to make the educational system or the health system of the country better.
Fantastic.
Even what they are projecting as brands, they do not believe in it. Correct. When they are ill, they travel abroad.
That's what I'm saying.
So what kind of engagement are medical professionals like you, your associations, having with government from time to time in a way that we'll be able to salvage the situation from going from bad to worse?
Let me explain to you one thing to you. When we sign CBA means collective bargaining agreement. It's a natural phenomenon that every 5 years there's a discussion. It's reviewed.
Have you had one recently?
Well, there's one happening now that has not happened in the last 14 years. In the last 14 years? Correct. So people that are earning salaries have earned the same thing as doctors in the last 14 years until we corrected now, about three months ago. So imagine you working as a civil servant and earn the same salary for 14 years. You can't even send your children to proper school. So for me, first thing is that government should decide How many years is productive enough to review the salaries of healthcare workers and document into a policy form? So people don't start negotiating again, or start going on strike to get what is actually their due. Priority. Number two is that our economy must be very, very accountable, which means if I give you budget as a leader of an institution, I said your budget is 1.7 billion, you must come and tell me, how did you spend the 1.7 billion? What is the outlook of that 1.7 million? Did you reduce malaria by 20%? Did you reduce typhoid by 40%? Did you reduce maternal mortality by 100%? You must put the budget into value outcome, not number of people you see. So people always look at it like bankers. They'll say, we have 10,000 accounts. That's not how to qualify growth in healthcare. You qualify growth by saying, okay, there's reduction in maternal mortality. Which means our mothers are delivering their babies properly, they are pregnant, they are going to the hospital in primary health care, and they're having their children, normal children. No death of children, no death of mothers. That's how to look at budgeting. But who is looking at these indices clearly on a yearly basis? Nobody. So when there's not an epidemic, like a COVID, like a Ebola, we'd all run out and say we're doing reactive mechanism.
Instead of proactive.
Whereas there's a budget for this thing before ab initio. Nobody's asking the question.
Okay, your engagement with governments and other stakeholders over the years, was it all about you getting more money?
No, that's the problem. People think it's about money.
Because that's the picture out there.
What's it about?
Hold on. It's about conducive environment. For example, you go into hospital. Sometimes the things to work are not available for you. You buy them with your money.
The basics.
The basic things. You want to do surgery in the theater. There's no fuel in the generator. You use candle to do. You use torchlight because you want to save somebody's lives. I get my point. So it's beyond salary. Is
it that bad?
Giving people hope that I have served my country. My country has also responds to me as an individual, that I can live well. For example, let me give you a scenario.
Is that bad that you use candles?
See, let me give you a scenario, my brother. A doctor left call in the night to go and save a woman's life. But guess what? It was killed and maimed on the road. Do you think people are having that joy? That I'll go and see, I have a patient that is in labor at night, now I'll go there. Because you now think, who's going to protect me? I might die too. Let's wait till morning. Now, it's not about money.
But you swore to an oath.
So the oath is valid. But there's an environmental nature to make the oath experimental and
Doctor, you've just
hold on, let me finish, Joshua. I, as Olowojebutu Benjamin, I'm addicted to Nigeria. I know that there's a role I have to play. But we must give everybody a sense of belonging. Let them feel that they are loved in their country. Guess what? Somebody during COVID, remember now, UK came with a fleet of plane to take our doctors away from here. 80 doctors had to go because the juicy offer was beautiful, and their children will go to school. They are giving them houses, and they're okay. It's not about money alone. How can a doctor can't afford a proper car? Give a doctor a good loan to buy a car.
But you have a car.
No, it's me.
Okay.
Not everybody has a car. I get my point.
Let
me tell you, Joshua, hold on.
Doctor, sorry to interject.
Hold on, Joshua. Hold on. I'm the guest. Hold on.
No, so I asked the question.
I hope you have not forgotten my question. Is it about money?
It's not about. I say it's not about money. But it's about conducive environment.
Thank you.
Money is part of it.
You are speaking.
Hold on.
You are speaking to.
Hold on, Joshua. Hold on. Now, your children need to go to a proper school, and they can't go to proper school. Are you going to be able to do it all properly? No. When our teachers finished medical school in this country, they gave them cars. They gave them houses.
The economy was good.
Let me finish now. As the economy went bad because of our problem as Nigeria, our anyhowness, our Nigerianness, we should also put measures to say, okay, are these people that we are training, are they better off in Nigeria or better off outside? because we have used our own money as Nigeria to also train them. But we don't pay attention to details.
So
that's my point.
See, sorry, I have to interject.
Joshua, go ahead. Let me hear you.
Because I feel a little bit inundated with this conversation about every aspect of government or our society wants a piece of government, perhaps due to the ostentatious lifestyle of those in government. They've not even helped matters in the first place. Correct. Or you have a situation where ancillary providers will say, we want better living condition. Truck drivers will want better living condition. Journalists want better living condition. In fact, journalists even have it worse off. You can just ask Jibola the conversation 30 minutes before airtime, what we had talked about. It's even worse off compared to doctors. I won't go into that as we speak. But you mentioned something very critical, and that is the environmental factor. So I don't understand why, and I spoke about this the last time we were on air. And look, Nigeria, as bad as it is, UK sent a plane to the country to just pack, let me use the word now in quotes, pack our doctors out of here. Now, the federal government, as bad as it is, subsidized medical training for our doctors here, and those guys were not magnanimous enough, or better still, were not patriotic enough to say, look, for a particular period of time, thank God you didn't sign any contractual obligations that you can work with. Let me even serve this country. Because do you have an idea how much you're going to spend if you go train abroad to study medicine? So having done all that, you're not patriotic enough. You did not look how bad our universities are, how our lecturers were not properly remunerated, how they were not getting the best of life, and you got trained, you know how to do this, thanks to your own hard work, but you just jettison that on the platter of greener pasture. Is it that green even on the other side that UK will come over here to come and get doctors?
So let me, I love your passion, Joshua. You know, I love when you speak. I like it. But the point, you cannot generalize a view because that's not how everybody feels. Nigeria is a country. Nigeria must show us the way. Nigeria must show us that it needs its people. Jibola said something very important now. Even our leaders, our politicians, are not proud of our healthcare system. You remember the last head of state, before he died, had just ear infection. Where did he go to? France. Don't we have enough ENT surgeons in Nigeria that can look at his ear and they spend taxpayers' money to travel? It's not their money. So if you compare citizens of Nigeria, and the leaders can also think that they can be followers one day, they will do things rightly. I said it before. Last night I said, if a chairman of a local government uses the PHC center in his locality, what will he do? He will validate the PHC center. Mm-hmm. It will make people in that community look at there's a PHC here, and they will come there. But most PHCs, people don't go there because the leaders don't even prioritize the PHCs. Are you getting my point? So for me,
they should start practicing what they are preaching.
That's it. So if, for example, now I remember the vice president maybe last year did a procedure in a particular hospital in Nigeria, and that particular procedure gave the hospital another 10 procedures from outside Nigeria. That is called validation. Yeah. The healthcare in this country is doing well. You have what have you done? You've improved the outlook of the doctors. You've made them feel loved that even a vice president can allow me touch him in this facility. They will want to stay because that alone produced more outlook for them. Okay. So for me, Jibola, hold on a bit, is that the government must show solidarity, must show priority. It's not about money alone. It's about sense of belonging. Somebody dies. I was telling the minister last week, I said, if a doctor dies of Lassa fever, died during active service, call the family. Pick a call. Call the wife, call the husband, call the parent. It makes them feel that this country believes and loves them. But nobody does that now.
And the service render was not in vain.
It was not in vain. Nobody does. But if a military man die, I don't armed forces, they don't armed forces day. Nobody celebrates the hard work of these doctors. We do a lot of work, Jibola.
Okay.
We do a lot of work.
Now, Dr. Benjamin, we have identified some of the problems plaguing the health system in the country, especially the shortage of manpower and the Japa syndrome. So for us to remedy the situation, what are those basic things that we need to lay on the table so that those that are coming to lure our doctors away would at least stop?
Jibola,
and the doctors will also start showing some commitment to their oath.
Jibola, can I add to your question?
Please
so
do.
that I answered it in one breath.
Please do.
And that is, can you borrow a leaf from what happened between the federal government and ASU? Now, they've been fighting something that they struck with Jonathan, and every time they go on strike is a function of that agreement they had with ASU. So this is what they did. They scaled it down, reviewed the whole process, and the whole conversation wasn't all about money. But look, you're going to do so infrastructure. You're going to go around that. You're going to provide loans for our lecturers. You're going to do that. Can you review it that captures the realities of our time as against just generalizing it, provide medical equipment, provide doctors, increase the salary, make it more holistic that captures the exigencies of our time and not just one hyperflating demand from the federal government.
Joshua,
just as Jibola so that...
Jibola, do you know that we are the most reasonable human beings in this Nigeria?
Who, doctors?
Doctors. Because...
Thank you.
Because we have signed an oath for life, which means life is more important to us than any other thing. Education Ministry has TED Fund now. TED Fund is 0.5% of Sovereign Wealth Fund is in the law, which means every university in this country has access every month to TED Fund. They have about $12.7 billion every month. Is in the what budget and is a policy for education. ASU got that right. We have told the ministry, set up a fund, tertiary health institution fund for also healthcare system, so that the funding will also be in the budget. 1%, you can say 2% of the sweeting tax fund, sweeting beverages,
sugar-based,
yes. You can say 1%.
SSB?
Yes, you can say 1%. 1% of that to this healthcare institution. Set up a bank of health, like you have bank of agriculture, bank of industry. Let that bank of health service healthcare owners and say, okay, take funding, one digit. Now, we have created an avenue for what? For growth, so that when people get the money, they increase capacity to help more patients. They increase capacity to train more people. They increase capacity to also what? Employ more doctors and healthcare providers. So, for me, if government says today that 0.3% of the Sweden beverage tax goes into healthcare infrastructure, say tertiary healthcare development fund, like you have TED Fund, excellent. Number two, if you create a bank of health and says all the doctors that live and work in Nigeria get a car loan, get a house loan, get a loan for your family for scholarship at single digit, Nigeria can afford it, because that's how we started Bank of what? Industry and Bank of Agriculture for the farmers. And they're working. So do that, it solves a lot of problems. And when people take loan, they are stayed back, because you can't take a loan on Japa, because the loan will follow you.
So the enemy had actually proposed this?
Definitely, we have proposed it now.
I'm very good to see the plan.
Joshua,
Dr. Benjamin.
We're not, see,
Dr. Benjamin.
Everything I tell you here, there are things we have proposed. We have gone even to the plenary session, public hearing in the House of Assembly, I have discussed it on the floor.
Can I add one more? There's also
Joshua,
there's
please,
National Health
1
Insurance
minute.
Scheme.
Does it bother the NMA that sometimes when some of these politicians or governors come, they come and commission buildings alone without equipping those buildings? Are you also fighting for that?
Definitely. Because when the government said to us in the last budget...
Because we see big buildings
Hold
with
on,
nothing inside.
But let me shock you. Last year's budget for infrastructure was 41.5 billion. But how much was released? 35 million naira. So what does that mean? It means you build the building, but you cannot equip it. Because you are giving the contractors IOU. Go and build, come and get money back because you are close to them. But if a contractor says that he has finished building a building and he's not seeing his more money coming, you want to go and put the equipment there? That's very expensive. I won't do that now. Are you getting my point? So government should be committed to accountability to the budget on healthcare in this country. You know that we are still very, very far from our 50% declaration in 2001. We are still at 4.7, 5.2 out of 15. So we are even low in budget. But as I've said, if we try and we are accountable to ourselves and tell ourselves that my child can die tomorrow too if I don't take care of this country. My child might not be able to fly. Maybe there's crisis. Like there's crisis in Iran now. People cannot fly. So if you don't take care of Iran's healthcare, where will they be going now when there's problem?
Okay, I've got two
Okay,
things.
Josh, make it a very quick one because of our
That's going to be
time.
my final question.
Go
to
ahead,
you.
Josh.
So have you looked at the possibility of doctors also lending a voice to either the National Health Insurance Scheme? Because I remember one time it was very prevalent during Obasanjo, and I guess this government has also revamped it as well. And of course, the LASHMA we have in Lagos, which make you have a pool for funding, and so that you have more people pulling. You know how this works.
Yeah.
And of course, it's also a source of funding for the healthcare sector
So
as well.
The last two salaries paid in Nigeria were gotten from pension and from NHI.
Exactly.
Which means that there's a lot of
So
funds
there's a lot of funding there that can also unlock.
Let me say something to you. You need to understand a few things. It was NHIS before,
Yes.
but it wasn't compulsory.
Yes.
Before Buhari went, it became NHIA.
Yes.
It became compulsory. But look at it. 5% of the civil servants in Nigeria are the ones only using NHI. Why? Because sometimes the tariff are not very good for people to latch on, or have not done proper engagement to the informal sector. That's why I celebrate LASHMA. LASHMA has done well. Ilerico has done well. I love what Dr. Zamba is doing. I've told her a lot. She's doing great stuff. And going to the grassroots, to the partisans, to the artisans, the market women.
Yes.
Those are the more population. But we have focused a lot, NHI has focused a lot
On the
elites. That we just put the money there and not use it. Are you getting my point? So the funds is just there lying there, doing a lot of mathematical things and things, and stuff. So for me, is all of us accountable. I told Kelechi, the DG, I said, if you go to Gombe or Yobe or Zamfara and talk about NHI to the people as the DG, they will feel that you recognize them. And it's not just Abuja or Lagos. You go to the it's called community entry. We're taught in community entry that you go to the people, make them relevant. Call all the religious leaders, all the imams.
Rulers.
Yes, let them feel you. But remember back in the days when we were younger, NOA that time, National Education. They will come in the morning, they will talk about cholera in Yoruba, in English, in Hausa, in Igbo, in the morning. And when it's 4 o'clock before NTA News, you remember NTA News now, they will not come again and talk about maybe epilepsy. And I think that it just needs to be revamped again. Because we must get into prevention medicine than curative medicine.
Now,
Okay,
thank
Dr.
you.
Joshua, we have to go. Dr. Benjamin Olowojebutu, first Vice President, NMA, speaking on how we can address doctors' deficit in our Medicare and what the government of the day will need to do to address some of the challenges plaguing the health sector system in the country. We thank you very much for your time, and we hope that government will do the needful at the end of the day. We'll take a very quick break. When we come back, we'll be talking about the cost of living right here in Lagos. Stay with us.